Hello everyone, welcome back to Pharmacon tutorial. Today let's discuss about the hemostatics. So let's get started. Hemostatics are agents that arrest bleeding by vasoconstriction or by coagulation of the blood. These agents are mainly of two types, those that act locally and the other that act systemically. These locally acting agents are used to control bleeding from small blood vessels and capillaries. For example, it's in case of tooth extraction, abrasion, or bleeding during surgery. While the systemically acting agents can be used to control bleeding associated with some bleeding disorders like hemophilia or Van Willebrand disease or hypothrombinemia and even in salicylate poisoning. Locally acting hemostatic agents include adrenaline, astringent, thrombin, fibrin, gelatin, calcium alginate, oxidized cellulose, and heme coagulase. Whereas the systemically acting agents are vitamin K, fibrinogen, anti-hemophilic factors, adrenochromomonosemicarbazole, then ethamsilate and desmopressin. Now let us discuss about the locally acting agents. So first let us see the mode of action of these agents, that is how they promotes coagulation. So first of all, about the adrenaline, it promotes coagulation by vasoconstriction on the alpha-1 receptor, whereas these astringents control capillary oozing by precipitating protein locally. Thrombin, which is a freeze-dried powder derived from the bovine or the human plasma, act by converting the fibrinogen to fibrin. And about the fibrin, this fibrin itself has fibrinogen, factor 13, thrombin, calcium and other clotting components. And again about the gelatin, it produces hemostasis by providing a physical meshwork on which clotting can occur. This calcium alginate promotes coagulation by providing calcium for the clot formation, and it also promotes wound healing. About the oxidized cellulose, they are applied dry so that it will swell up and help formation of clot. And about the hemocoagulase, it is basically an enzyme that will convert fibrinogen to insoluble fibrin and thus promote clot formation. And this hemocoagulase, it is very powerful and it will see bleeding time and the clotting time. Now about the contraindications. These adrenaline, it should not be given in patients with hypertension, arrhythmia, angina and even in ischemic heart disease because it will precipitate myocardial infarction. And this thrombin should not be given as injection. Now about the side effects of this locally acting agents, this thrombin will cause a hypersensitivity reaction and this oxidized cellulose will cause tissue necrosis, nerve damage and vascular stenosis. And this oxidized cellulose is used where ligation is not possible. Among these locally acting hemostatics, adrenaline, astringent, thrombin, fibrin, gelatin, calcium alginate, oxidized cellulose are given topically, whereas hemocoagulase is given IM, IV and subcutaneous route. Now coming to the systemically acting agents, first let us discuss about the vitamin K. This vitamin K, it is a cofactor and it is required for the synthesis of clotting factor 2, 7, 9 and 10. And it is also required for the gamma carboxylation of the glutamic acid residues of the osteocalcin, which is needed for the bone development. Vitamin K is administered orally, IV and subcutaneous. And among the three forms of vitamin K, that is the K1, K2 and K3, that is phytonadione, menaquinone and menadione respectively. This K1, that is the phytonadione, which is derived from the plant and the animal source, is more safe to use. Whereas this K2, it is produced by the intestinal bacteria, and K3, it is the synthetic form with most side effect. This K1 can be used in bleeding associated with vitamin K deficiency, in obstructive jaundice where it is given as parenteral, and it is given routinely to the neonates to prevent bleeding, as the intestinal flora necessary for the synthesis of vitamin K is not developed in these neonates, and it can be also used in salicylate poisoning. The main side effects of this vitamin K is flushing, dyspnea, cyanosis, and anaphylactic reactions. This IM and subcutaneous route may cause severe pain and bleeding at the site of injection. And about this vitamin K3, that is the menadione, it is not used in neonates because it may cause hemolysis, hyperbilirubinemia, and kernicterus. So it should not be used in neonates. Next, moving on to fibrinogen. This fibrinogen is basically obtained from the human plasma, and it is used to control bleeding associated with hypofibrinogenemia, and it is mainly given in IV infusions. Next, about the antihemophilic factor, which contains the coagulation factor 8 with this von Willebrand factor, and this is mainly used to control bleeding in the hemophiliacs. It is administered as IV infusion, and the main side effects associated with this is the fever, chills, headache, and skin rashes. And again about the adrenochromomonosemicarbazole. It is the oxidation product of adrenaline, which is administered orally as well as IV, and it is mainly used to control capillary oozing. Next, about the ethamsulate. So this is an hemostatic agent which corrects the abnormal platelet addition and is also used to maintain the stability of the capillary walls. It is mainly administered as oral, IM, and IV administration. And finally, about the desmopressin. It is a synthetic analog of vasopressin, and which is mainly used to control mild and moderate bleeding in hemophilia A and the von Willebrand disease. It is mainly administered as slow IV infusion.